We're here again for our Tuesday call with you guys. So I'm here with Dr. Monique Middlecoff, and the two of us are the co-creators of our program Abs Core Pelvic Floor, which helps women that are going through things called Diastasis Recti, which can be ab separation that can happen after you have a baby, pelvic floor dysfunction, which has a whole range of issues. In my case, I would accidentally pee my pants if I would laugh too hard, cough, or sneeze, and just improving your core function as a whole. So we're super excited to have you guys here today. If you guys have any specific questions, go ahead and leave them in the comments. It looks like we don't have any viewers yet. So hold on, let me just make sure that our connection is good.
You got it.
And then give me 1 second. Okay, good. We've got some people on. Good. Okay. So if you guys are on, leave a comment and let us know where you're tuning in from, first off. And if you have any kids, leave it in the comments. I love hearing, it's fun for me to see your guys' names, but it's extra fun for me to feel like I know more about you guys and learn a little bit more about you. So one of the first things that Monique and I wanted to talk about today, because we haven't really talked about this in any of our Tuesday calls, is pelvic organ prolapse. And so this is a topic that truthfully, before I met Monique, I didn't know anything about pelvic organ prolapse. I just didn't even know that was a thing. And I really wholeheartedly wish that more people talked about it, because I think that there's a lot of women that struggle with pelvic floor dysfunction. And because nobody talks about it, they don't even know what kind of symptoms to look for. And so if you're experiencing anything and pain during sex, if you're and Monique can talk about all the symptoms, but like vaginal heaviness, a lot of discomfort, then there's a chance that you might have some prolapse issues. So I have a little bit of a funny story here that I want to tell, and then I'll turn it over to Monique and she can talk more of the sciencey stuff about it. But, oh, good. We have a lot of people. Okay, so Anya says hi. Melanie says hi.
Hi, everybody.
Says hi. Flair's from Canada. Brooke's from Texas. Melanie's from Virginia. She has 2 teenage boys. Oh, I'm nervous for the teenage years, so you're going to have to give me your motherhoodly wisdom. You're a couple years ahead of me. Lori says, hi from Tennessee. I have 3 boys. Oh, you're amazing. Kristen, 1 10-month-old son and starting to try for our second. Gavin says hello. Awesome. Cool. Okay, so a funny story real quick, and I'll keep it kind of short. So when I first met Monique, she taught me so much that I didn't personally know about pelvic floor issues. And so the word prolapse to me, I didn't even really know what that meant. And she explained to me that there's 3 different kinds of prolapse that we can have. There can be vaginal prolapse, which is where the your organs descend down further than they should in your vaginal cavity. So your uterus can kind of descend down further than it should be. There's bladder prolapse, which is where your urethra will start to kind of bulge out, and it can be really painful when you're going to the bathroom. And then there's also anal prolapse, which is, where your anal cavity will start to kind of push out. Like a mild version of that is a hemorrhoid, right? But then there can be severe cases of that. So just a funny story. It's not a funny topic. I mean, it's something that's actually really serious, and so many women have issues especially after childbirth, that can be improved. That's the good news. But a lot of people just don't know what to even look for. But the story piece of it is I was so fascinated by it because I didn't even know that this was a thing, right? So I was staying at Monique's house. I think we were taking pictures or something. And so that night we said goodnight. We went to bed, and I was like, I'm kind of curious about just what that looks like, So I Googled vaginal prolapse, and I was like, oh, wow, that's really interesting. That's interesting that's what that looks like. And apparently cattle ranchers, prolapse is really normal for cows when they have their babies, and they have to kind of push everything back up and so I'm back up together. So I was like, okay, that's kind of interesting. And then the bladder prolapse, I was like, wow, that's really interesting what that looks like. And then I Googled the anal prolapse, and I will just tell you right off the bat, don't do it. Do not do it.
Don't do it. Don't do it.
So many men that have sexual fetishes with women who have an anal prolapse. And all of a sudden, all these XXX sites came up, and I was scarred for life. So now everybody's probably because I told this story. But it's interesting. So the word prolapse kind of it's a broad range. There's different kinds. And then even within the type of prolapse, there's different severities, level 1, 2, and 3. So Monique, do you want to kind of take that for a second and explain, what kind of symptoms might somebody have if they were experiencing some prolapse? And then what could they do if they were suspecting that maybe they had some prolapse issues?
Oh, it's a great question. Well, prolapse, I just like to think about, the pelvis, and we're looking at the organs that are on the inside. And, we typically think about things like a vagina having prolapse. that could be something that you could see visually from the outside, maybe being able to feel a bulge or a kind of sense that something is just a little bit lower than it should be sitting. You already mentioned that kind of feeling of heaviness below. That could be something that could just give us a bit of an indication that we have some prolapse present. And just like what you said, where there are different types, we typically talk about vaginal prolapse. Sometimes that can be after a hysterectomy, where there is no uterus present. When we have additional space inside, gravity can shift things down quite a bit, and that can cause some symptoms like incontinence or maybe difficulty voiding. That could be on both ends of the spectrum, where we might have difficulty completely voiding our bladder, or we might have difficulty with constipation, really struggling to completely void. And that's something that can be really improved if we know what's going on below. Now, I think a lot of women, we tend to just troop it out, right? We're phenomenal about just trooping it out to say, oh, it's not that big of a deal. I'm totally fine. It's going to be no big deal. And we avoid getting things checked. And it really does make a difference with prolapse when we know what's going on. So anterior wall is just the front side, posterior wall is just the back side. So we would say anterior wall prolapse, posterior wall prolapse, or vaginal prolapse. And with that, some of the things that I think can be really helpful is to know that if we're not eating enough fiber in our diet and we have a lot of constipation, we can push a lot of pressure below, and that's even without having babies. So we know that there can be a lot of pressure sitting on the pelvic floor when you're pregnant, and with delivery, often we're pushing, and that additional pressure can cause some of that weakness that we can see that kind of causes just a decrease in support. So when our pelvic organs aren't as supported and there's that decrease in stability, things fall down because of gravity, especially if we have a big circumference in our waist, that we're carrying more weight in our waist pushing down on the pelvic floor. We can have some issues with prolapse as well. And so it's just important to know that pelvic strengthening is important. We talked last week about a hypertonic pelvic floor, but most women, we have a weak pelvic floor. So it's important to work on handling the loads appropriately, working on building the strength and support so that we can do the activities we want to do. I think it's important.
Yep, 100% agree. And I will say, it can feel embarrassing to talk about, right? I remember after I had my son, it was like a really hard labor. He was a 10-pound baby. I pushed for over 2 hours, and I did have some issues after I had him, just from bearing down and pushing for that long. So the one piece of advice I always say is that it's very normal after you have a baby to feel vaginal heaviness in the first 6 weeks. That doesn't necessarily mean that you have you'll have a long-term prolapse issue. It's just that's pretty common. But what I would suggest is that when you go in for your 6-week checkup, if you're having any symptoms, pain during sex, difficulty going to the bathroom, just like Monique mentioned, or hemorrhoids or vaginal heaviness, like at the 6-week point, if you're still having those issues, then just bring it up and mention it to your doctor or your midwife, because they're not mind readers. And if they don't know that you're having those issues, even though it might feel embarrassing, I promise you it's not embarrassing to them. They want to help you. So definitely bring it up, and then they can either refer you to a doctor who can specialize and help you with that, or they can give you suggestions as well.
And I like to think about writing down a list of questions in advance. And if you especially know that kind of in the heat of the moment, sometimes if you're feeling a little uncomfortable, or especially if you're having an exam, we can forget the things that we wanted to ask in advance. So if you write them down, it can just give you a little bit of extra prompt to say, oh yes, I don't want to leave before I find out about, X, Y, and Z, or whatever your question is.
I wonder together a little cheat, everybody. These are the all of a sudden I'm getting an S. Okay, can you maybe drop your volume and see if
Does that make any difference?
So let's try this. What in the world? Okay, hold on one second.
Okay.
Back, I think. Oh, that seemed to fix it. Okay, good. So we know now if there's an echo. No, it's still there.
It's still there?
Okay, I'm going to try headphones.
Okay.
While I'm doing this, why don't you read this?
Oh, sure. You got it. Okay. Rita asked a great question. I just started pelvic floor physical therapy, which I never knew existed. Most people don't know that this is a really important specialty, so you're not alone. This plus Natalie Hudson's exercises, I'm hoping change my world. I think that's fantastic. Anytime that we have an opportunity to kind of get that personalized care, and then also know the exercises that make such a difference in our pelvic health and our core health, that just gives us such a strong foundation to be able to move and feel comfortable to do activities without having that additional leaking or having those additional barriers to our physical activity. I feel like exercising can be hard enough as is. Let's remove all of the things that make it more challenging and just feel good in our skin. Rita, that's awesome.
Yes, I 100% agree. Darn, still.
Natalie, is that better on your end? Can you hear without an echo?
No, there's still an echo, dang it.
Okay, let me try even taking my volume down even more. Does that make any difference to you?
Okay, let's try this. Will you guys comment and let me know if you hear an echo? Because I think there's still an echo. Bummer. Okay, so let's go on to the next question. Monique, do you want to read it?
You got it. Okay, I'm not sure if this is way off topic, says Judith, but I actually have a question this time. Woohoo! Are those hang-ups by teeter tables bad to use if you have any issues with diastasis recti or really just after a baby? Now, that's a great question. Now, for those of you who might not know what a teeter hang-up is just kind of an opportunity to do sort of like an inversion table where your head would be down below and your feet would be up in the air. Sometimes they have like the teeter boots that you can clip on, and sometimes there's like a table that you can just sort of naturally turn up. Well, I wouldn't say it would be bad to use. Interesting story, just kind of off of that, without violating any HIPAA. We actually had a patient who had a heart attack upside down on one of those tables. So that's not a fun way to experience a little bit of a extra surprise in your day. But overall, the tables themselves don't cause heart attacks. That's not the concern. But it can be nice to just work on elongating your body. Sometimes it can help if you have any sort of issues with your spine, especially like a bulging disc. It can just provide a little bit of extra tension. But don't do it by yourself, especially if you're by yourself. Sometimes you can get stuck in an upside down position. That's not ideal. But I wouldn't say at all that it's bad to use. Don't use that. I wouldn't say that at all. But I'm not completely sure if there's some evidence saying that it's tremendously helpful.
Good. Awesome. Good to know. Darn, everybody's saying there's still an echo and I'm still hearing it. Oh, gosh, darn it. So I don't know where the problem is, but Monique, what I'll do is I'll just pop the questions on and I'll let you read them if that's okay.
Oh, sure. Sure. Is it echoing my voice too?
Mm-mm.
No, okay. Mary asked the question around how are the daily exercises?
So but we typically see that most people do them in less than 20 minutes. I don't think that with any one muscle group that we have a lot of benefit around after the 30-minute mark with the same small muscle group. Now, if we're working on our total body, that's one thing. But if we're just looking at our core and pelvic floor, we want to really focus to work on the right muscle groups and then give it a rest so we can do the rest of our daily activity. So there is some rest periods built in. And if you need to break it up, let's say you have little kids or things happen or interruptions happen, you can sort of space them throughout the day. But typically, if you were to do them all in a row, it takes 20 minutes or less.
Exactly. Completely agree. Okay, wait, hold on. Now I'm talking and I don't hear an echo. So
okay, that's good.
There's some hope. There we go. I don't know what changed, but there we go. Oh, I don't know if it's maybe the software or what. So can you guys, again, before I know all you guys commented and said there is an echo, can you comment now and just confirm that there's no echo, which would be amazing if there's not. Okay.
Yeah, you sound clear to me over here, Natalie.
Good. Okay. Good. Okay. So Allison has a great question. She says, can you shed any light on the C-section shelf? What can you do to get it to go away? So I'll give my opinion on this and then Monique, maybe you can chime in too. So when you have a C-section, the muscles of your abdomen are cut open. And so sometimes depending on the stitching that the doctor does, it can cause, sometimes that skin can have a little bit of an overlap or like the word shelf, which for some reason I just hate that phrase because I'm like, oh, I don't want moms to ever feel like any part of their body is the shelf, you know. But the one thing that you can do is just reduce overall body fat in general. That will help. If it is any consolation, if it makes you feel any better, like even though I had my babies vaginally, I still have skin that kind of hangs over a little bit. And then, focusing even on our abs core pelvic floor, if you have any kind of diastasis present, helping to close those abdominal muscles and bringing them back together, which is what our program aims to do, can help with any appearance of, a shelf look at the bottom or a gap at the bottom by bringing those muscles back together. Weird, the echo just came back on.
Oh, did it? Oh, darn it. Yes, well, Natalie, I'm with you. The only thing I would add to that is that our deep stabilizers, especially when we're talking about our internal or external obliques or transversus abdominis, it's kind of like our internal girdle. And while it's not a perfect external girdle, it really helps to support and provide additional stability from the inside. So Allison, if you have an opportunity to really work on those deep stabilizers to really bring in kind of using that contraction motion that helps to kind of suck in that girdle, it can just provide some additional stability that, along with losing some extra body fat, can help to provide a really just a comfortable and functional core. So we can't always say it will go perfectly flat or there will never be an issue, but the more stability that we have, the better it's going to work, which will make the whole appearance even change.
Yes, exactly. The other thing that I've had to learn to do is just learn to embrace and accept our changing bodies. Like, my body will never look like it did before I had babies. And I have an echo, so I'm going to end this thought. Let me turn the camera off and turn it back on again. Hold on.
Okay, you got it.
Why don't you read the next question while I do this?
Perfect. Or recovery different, and how should I adjust my expectations for that recovery? Katie, what a home run question. Holy cow. You're absolutely right. The expectation for recovery is different when we've had multiple C-sections. And we know that the older our bodies are, the slower our cells turn over, which means our recovery is typically going to take a bit longer. The better we care for ourselves with really great diet and exercise, the quicker our cells will turn over, which means that our repair and restoration will happen more quickly. So in terms of differences, obviously, we had major abdominal surgery. Obviously, C-section is going to be completely different than a vaginal delivery because we're cutting through that entire rectus abdominis, getting down into the actual uterus itself. That's major abdominal surgery. So obviously, setting those expectations of knowing my recovery is going to be longer. Typically, with a vaginal delivery, anywhere between 6 weeks and 8 weeks of the time frame that we could expect to start adding in activity again safely. We typically say 8 to 10 weeks for a C-section. So you've been through this, 3 times, so you know that it's just different. And the more we go through opening up those scars that already exist, it's just going to take a little bit more time. So I would say give yourself a lot of grace. In the meantime, if you can, I know it's hard if you've had 3 C-sections, that means you have some babies. So give yourself some great nutrition that you can keep in your fridge that's easily accessible. Sometimes we put ourselves in the back burner, and if we're missing those nutrients that helps us repair, it can just delay our recovery even longer. Natalie, do you have anything to add to that specifically?
Yeah, the only other thing I would add, and it sounds like the echo went away, so that's, I guess, our little trick is I have to turn the camera off and then bring it back on, but is that oftentimes after a C-section, you'll have pain on the incision mark. And so what you can do is really massage that incision. At the beginning, it hurts. It does not feel good. And I have a video on my YouTube channel showing how to do that. The other thing is that when you cough or sneeze, and this might sound a little weird, but if you have a pillow nearby, if you grab a pillow and brace your core with that, or even just kind of hug yourself when you're sneezing, what that can do is make it not hurt so much on that incision spot until that scar has really fully healed and recovered. Those are some just tactical tricks. And then the other thing is just to remember, and I know this is the last thing that anybody wants to hear, is that before you're given clearance to exercise from your doctor, for probably the first 2 to 2.5 months, don't jump back into any kind of core exercises too fast, because you actually can cause more damage and make your recovery harder in the long run. Now, I get it. When you're 2 weeks, 3 weeks, 4 weeks postpartum, and all you want to do is feel like yourself again, that's the last thing you want to hear. But definitely take it slow at the beginning, ease back into your exercise. And then the last thing I would just add is that our abs core pelvic floor program is awesome for women who have had C-sections. We've had a lot of women with C-sections go through our program and see really good results. So I would just make sure to be in tune with your body, pay attention and listen if you're having any kind of pain or, all the issues we tell everybody, pain or still having ab separation or incontinence, vaginal heaviness, those are signs you should slow down for a little while and then continue to gradually ease back in. So that's the advice I would give. And I just want to remind you that you're amazing. So, okay, so we have about 6 more minutes. And I'm getting echo again. So Monique, I'll let you read this.
Okay. Okay, Ruthie says, I have a 2-finger gap. Be less risky to cause problems. Ruthie, this is a great question. And just as a reminder for everyone that what we're concerned about more is the actual tension of the linea alba rather than the width of separation. So we like to say the depth of depression. So if you're thinking about pushing inward or pushing towards the spine, we want the linea alba to be able to withstand force. That's how we know from a core perspective that our body is able to handle higher loads. So if you still have a gap, Napoli even has a small gap that's still present, and we would consider that diastasis recti healed because the linea alba, or that center connective tissue, is able to withstand force. So that's what we want to check for, is the most important thing. But some of the things that you can do that help to use more, maybe if we're talking about weight loss, more calories that are still safe for the core, is doing something like a recumbent bike, where you're in a seated position, biking, cycling with your legs. That can be a really wonderful way to keep your body fit while you're recovering your core dysfunction. That it just helps to take off some of the load and intra-abdominal pressure, which can be a really wonderful way to do some of those higher intensity workouts safely. Now, the things that are going to probably cause problems if we're still having a really soft linea alba, doing things like running, jumping jacks, high intensity interval training, those are the things that are going to exacerbate the problem and make it worse. So we want to back off and the intensity just because of the intra-abdominal pressure. Now, we always want to remember that it's not a bad workout or not a bad exercise. It's just we want to think about what's appropriate right now for the goals that we want to reach. So if we're working on healing and recovering our core function, low intra-abdominal pressure combined with the right exercises that help regenerate connective tissue, that adding that tension with collagen and elastin fibers, that's what we want to work towards. So I really recommend recumbent biking. Works really well. Sometimes if you're on an incline, doing an incline walk, that can be a great exercise too. It's more challenging than flat ground walking, so it can help raise our heart rate quite a bit.
Yeah, definitely. I love incline walking. Darn it, I still have an echo. So I agree with 100% of what Monique said there. So it looks like actually that was all of our questions. So
super.
Yeah, so I guess you guys, these calls, actually, Monique, I'll let you end it because I'm echoing like crazy.
Oh, you got it. Okay. So next week, we'll be meeting at the same time to keep answering these questions. I think it's so important just to have a venue where we know we can ask questions in a safe space where there's no judgment or criticism. Sometimes it's embarrassing to talk about things maybe with your friends if you haven't had that open dialogue in the past. So we just want to create an environment where we're able to talk about things that really affect us on a day-to-day basis. So we'll be here Tuesday next week doing the same exact thing. I think we want to talk about some body confidence issues and pubic symphysis dysfunction, and just to be able to open those lines of communication so we can help educate each other, empower each other. It's something that's so important to both Natalie and myself, and we'll be here, do it all over again. So have a wonderful week, and we'll see you next Tuesday.
Bye.